Okay, welcome back to part two of what I wish I knew before getting immediate dentures. So now we're out at about a week and a half, 2 weeks, and it's been a crappy ride, a roller coaster ride, but you're starting to really heal. Okay, dentures are starting to get really loose. You've got that first temporary soft reline. Things felt great for a minute, and now things are starting to get loose, and they're going to continue to get loose because your extraction sites are closing up, your gums are starting to heal more, the bone is starting to shrink a bit, but there's hope, okay? You're developing muscle memory that you probably don't even know that you're developing yet. You're kind of learning to hold your tongue, down over that lower denture. You're starting to learn how to establish that suction on the roof of the mouth with that upper denture. You're learning to kind of clear that excess saliva out of your mouth to give yourself a better chance at getting a seal. You're developing muscle memory in your cheeks to be able to hold those dentures in a little bit more, and a lot of this you don't even notice. You're starting to speak better. You're starting to understand that you need to chew on both sides of your mouth so you don't teeter-totter the denture, because you're starting to eat some really soft stuff. Nothing too crazy yet, but you're starting to learn. You're starting to get a little bit of the hang of it. And it's gonna get cruddy again. I'm gonna be honest with you. It's a roller coaster. And the first part is crazy, and you were excited to get your teeth fixed, to get a beautiful smile, and then you got really scared because it was all really shocking. You have this big huge denture in your mouth because it feels humongous at first. The bleeding is scary. Seeing yourself with different teeth, that's really shocking to a lot of people. They have seen themselves a certain way, good, bad, or not, and now they're seeing themselves in a completely different, human being in front of them in the mirror. So it's a roller coaster. But now you're getting to know your new smile in the mirror. You're starting to learn to speak better. You're starting to graduate into more solid foods. And sometimes you need adjustments during this period, and you need to contact your provider if you get any areas that are really, putting pressure, or if there's any, lacerations or rubbing marks in your mouth. You need to let your provider know so that those can be adjusted. When you're getting up to about that 4 to 6 week mark, that denture's getting really loose, even though you had that soft reline in it. So time for another soft reline. So they lay more material in there, and it's like having an impression taken. It captures the anatomy of that stage of your healing and fills in those gaps, and it stays in the denture. So now the denture's tighter and it's fitting snugger. You're able to get better suction on that upper, and the lower isn't wanting to fly up. These are things I want you to pay attention to, though, in the process. If your denture is, like every time you lift your tongue, it's flying up, the inside ledges might be too long. Okay, they're called phalanges. If when you open your mouth wide, these muscles flex, and if the edges are too long here, it can lift them right up on that lower. Same thing on the upper. When you open your mouth wide, when you flex that muscle, if the dentures are trying to come down, sometimes this muscle right here, when it flexes, it'll grab the edge of that denture and pull it down. So it might be too long, a little bit too long. If you are gagging, it might be that denture is loose, which likely it is in the immediate denture process. It might be that the roof of the mouth here has thickened up because you're putting layers of soft reline material in there, and it might be getting so thick and having such an abrupt edge right here instead of a beveled edge that your tongue is kind of catching on the edge of that and it's gagging you. So we don't really want to make these dentures too short, because the shorter this is, the more chance you're not going to get suction. So, but you can shorten it a little bit. I do this often for my patients just to shorten that up, because you want the denture to be not all the way into your soft palate area. That it'll make you gag and it'll make it fall down. but you don't want to have it too far forward on that hard palate because it won't get suction. You know, there's a point in which you won't be able to get suction anymore, and you'll likely have to wear adhesive. And of course, the minute I say this, I'm gonna have comments in here saying, I have a horseshoe denture and it stays up just fine. I want to see the receipts on that one. If I don't see it, I don't believe you. Just kidding. I don't. Anyways, so, you know, you need to get adjustments if it's really hurting you, if it's gagging you, if you're doing those movements and it's popping up. Those are problems, okay? You need to get those addressed. What you are really waiting for is that 6-month point. And, you know, some providers have different guidelines. I've been doing this for decades, and 6 months is the stabilization point that I have always observed in my patients. At 6 months, their healing is stable. They are ready for either that permanent reline or that permanent denture at 6 months. I've said before a bazillion times in my, you know, posts on here that 98% of the time I make an immediate denture. We do 2 soft relines in it, and at 6 months, I put impression material in there, put it in the patient's mouth, have them bite together, you know, do the relines, and I do a hard reline in there. I take all the temporary material out, replace it with new acrylic, recontour and rethin things out, the roof of the mouth, the sides, everything, and that's their permanent denture. And they get years out of that before they have to go and buy a permanent denture, even though, I mean, this becomes a permanent denture in my office, but you get the gist. Anyways, that 6-month point is when you're really at your finish line for the roller coaster, okay? For the rest of your life, your tissues, your bone will recede, you know. But if you're wearing a good fitting denture that is snug to your mouth and it is stable and it's not moving around, you know, your bone shouldn't shrink rapidly, okay? But if you're wearing a denture that is way too big and you've got to put a gob of adhesive in it to hold it in, then that's going to be rubbing and rubbing and rubbing against that bone, okay? And you're going to get bone loss. Last thing I want to say that I always tell my patients, dentures are not a one and done appliance. You don't just buy a denture and wear it for 20 years, okay? I mean, people do it. I've had patients that have gotten their dentures in the Vietnam War since before I was born, but the teeth are all chewed off and flat, and their bones are flat as a pancake, and they're huge big, okay? They have no bone left. So then they want new dentures after 40, 50 years of wearing them, 60 years of wearing them, and now they got no bone left, and they don't understand why it didn't restore them back to the first time they got dentures. It's because they have no bone left. So I probably will get more comments in here saying, my grandma had her dentures for 75 years. It was the same denture she had forever, and she could eat, 19 corn on the cobs, whatever. I don't believe it. But anywho, some people are very adaptable. I hope this helps you guys, and I hope you have a great day. Drop some comments if you have questions, and like and share my stuff, okay? Have a great day. Bye-bye.